Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello everyone. As you know, All Home Care Matters is here to provide helpful tips, resources, and information for you and your loved ones. Today's resource is brought to you by ADA. For many of us, we may think of COVID-19 as being over, but for many of us, it is still a great concern, especially if we have existing health conditions or are in a certain age group. Did you know that nearly 75% of American adults have at least one risk factor that puts them at high risk of progressing to severe COVID-19, and many are unaware of their risk? That's why I recently took a free health questionnaire powered by ADA, one of the world's leading digital health companies, to learn more about my risk status and discover if I am eligible for treatment that could reduce the severe effects of COVID-19. Let me tell you, it was quick and easy. By taking the questionnaire in the comfort of your home, you get important information on your risk status, but also easily get connected to an affordable telehealth provider, ready to speak to you within 2 hours to learn more about treatment options. The questionnaire is endorsed and trusted by doctors and healthcare experts, and it only takes a few minutes, so click on the link to take ADA's free questionnaire today, and let's all stay safe and healthy. Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome Dr. Catie Chung. Welcome, Dr. Catie. How are you?
Thank you, Lance, for having me. I'm super. How are you today?
Wonderful, wonderful. So, I wanted to first start off how we initially met, and that was actually through Instagram, which is usually not the case for our guest. But one of your reels that you had put up caught my attention and someone on our team's attention.
Hey, what's up? So, Gen Xers, I have a Gen X friend who I convinced to come over to the Insta, and she kept sending me all these links of reels and posts and stuff. I was like, what are you doing, yo? And she was like, well, isn't that how you share? I'm like, no, there's a paper airplane button. So I just thought I would post this as a PSA in case you need this for any other Insta newbies. If you're really brave, share it with your mom.
And you said, yo, and that it just hit me, and it really resonated with us here, because it's really about what you don't know. And a lot of people don't know what they don't know. And that's kind of what we're going to be talking about today with this interview. And that's, people don't know what they don't know when it comes to caregiving or, supporting their aging parents or their loved ones. And that's what you're here to talk with us about today. So let's kind of start with your background. I introduced you as Dr. Catie Chung, and if you wanted to just share a little bit of your background and education, we'll start with the questions after that.
Sure. So a lot of people don't even realize, but I actually have a PhD in nursing. I am a registered nurse, and then I just kept going back to school. Got my master's and then got my doctorate in nursing. And along that journey, of course, practicing as a registered nurse, I encountered so many different people and so many different families. And the bulk of my practice was as a case manager in home health. And doing that is a coordinating job, right? I would work with the physical therapist, occupational therapist, speech therapist, CNAs, nursing assistants, the physicians, and try to coordinate all this care for patients who most of them had just gotten out of the hospital and were at home. And so many times I would have to look into a patient or a family member's eyes, and they would just look at me lost and say, what do I do? And that stuck with me, of course, being a nurse and really wanting to help people, right, and feeling like there was a limited amount I could do. So going back to school, For my doctorate, I learned a lot about research and about teaching. And I teach graduate nursing students now, and volunteer in the community. But I also am working online, like you said, on Instagram and on my website, to try to help people fill these gaps, the gaps that they really are figure out in crisis,
Right.
because we don't want them to get to that crisis point. It's so hard and so stressful.
Absolutely. And, it kind of goes back to what we said, and we might say this a few times today. They don't know what they don't know. They don't know that there's gaps there necessarily that are there. They may not know what led their parent or their, loved one to end up in the hospital to begin with. And a lot of people, I think, have this perception in their minds about the hospital. Well, my loved one's sick, they're going to go to the ER or they're going to go to their doctor. And because their doctor sent them home with a prescription, or the ER maybe admitted them or didn't admit them, once they come home, they're all better. And why don't people just continuously stay in a hospital until they get better?
Well, hospital care now is so prohibitively expensive. Even if you have insurance, it's very expensive for people, families, and individuals, as well as on the hospital side. The costs are just really out of control. And that care that they're getting in the hospital, yes, it's 24 hours, but it's really only to get people to a point of being experience a really terrible sickness or trauma and getting to that stable point. It's not to get to wellness. And that's what a lot of people don't understand, because that has been a change over the decades.
Right. Absolutely. Well, and the other thing, I think, to just piggyback on that, when you go to the ER or you go to the hospital, they don't necessarily know all the other underlying factors either, and I think people have this perception again where I'm going to go to the ER and my dad, my mom, my spouse, even, they're going to tell them everything they need to know, or the hospital is going to ask all of the right questions, when that's not often the case. We deal with countless families with our business, and just the other day we had somebody who's in late stage cancer. They were in the ER for 4 days before they were even able to be admitted into a room. They're in a hallway on the gurney. They're not getting 24/7 attention, in the sense that they're not maybe necessarily getting a very deep, thorough history. They're going to get all the baseline facts, but they may not know that that person at night wakes up every couple of hours because they have to go to the bathroom, or they're having leg pain. And those are the issues that will probably persist once that person gets home, if they're not addressed in the hospital. And that's why it's not a cure-all, end-all by going to the hospital, right? I mean, you got to have a good advocate also there on your behalf.
Yeah, absolutely. And most people don't realize going to the hospital is not like respite for them, for the family. It's a place where you need somebody to be on duty with you, watching out for you. Unfortunately, hospital care right now is really challenging in so many ways because of staffing issues. Having gone through COVID, the staffing is really challenging, and I see that persisting for a long time.
Yeah, and I would say, with our business, we deal with a lot of healthcare systems, and I would never single one out. I'll just say there is a healthcare system here where we're at. They said to one of our case managers, they have over 600 open positions, 600 open positions, and they just can't fill them. They cannot get people. And I'm not picking on hospitals. This is your rehabs, your assisted livings, your home cares, your banks, your grocery stores. That's maybe a topic for a different episode, but it's everywhere, and that's where the family is playing even a more important, vital role, because they have to be the eyes and the ears for that person's primary care doctor, or that, visiting nurse that comes every couple of days, whatever the case may be, because they're experiencing a lot larger caseload, and they might have just worked 6 straight days without any time off. Some things are going to get lost in translation or not get asked, and you have to be there to advocate for them. So I wanted to ask this too. So let's say a person needed to go to a specialist, to have labs done or get some scans done. Why would somebody's family care provider, if that was the case, recommend them go to someone out of their network?
So that's a really interesting question. When, with all the insurances there are so many. And the office that referred to the specialist doesn't know. They didn't intentionally, try to do something that would be more expensive for someone or try to make it more complicated. They just don't know.
Right.
They don't have that information. So that's another reason that advocacy is really important, to be able to look into the insurance and what the coverage really is. I work with a lot of Generation X folks. Those are my people. And most of us are just getting to the point where our parents are looking like they might need some help. And nobody really understands what to do about that.
Right.
But one thing that's really helpful is what we have is tech skills. And everything's online now, right? You call the insurance company or you call the doctor's office or you call to get lab results and they tell you to push whatever button. And they say, well, you can get this quicker if you just go online to our website, right? Well, like for my mom, for example, she's 78. She cannot stand that. That drives her batty. She does not want to go online. She's pretty good with tech, but a lot of our seniors don't necessarily have those skills. So that's a really good way that we can help them out.
Absolutely. And, I think too, what COVID, I think, has almost forced upon a lot of our seniors is those that didn't like using online resources or even online shopping, they were left with no other option and they were kind of thrust into it. And a lot of them are trying to go back to the way it used to be. And the way it used to be is still not so readily available for a lot of people, seniors in general. And, it's a slippery slope, because they, again, kind of going a little off topic, they can be susceptible to scams and bank fraud and all kinds of things. And I always tell people, if your loved one isn't comfortable, you need somebody to help them, because the next thing you know, they're giving bank information thinking it's safe. And then you're going to have a whole nother set of issues on your hands. What about if your parent isn't independent all the time, but they need to go to a facility? What do you recommend on that? If a person's like, I'll give you an example. We had a person, they were quadriplegic. They had suffered a couple of very severe strokes. They wanted to stay in their own home as long as possible. They didn't have children, so some of their siblings were trying to help coordinate the care. And the siblings some of them were 20 years older. We're talking 60s to 80s, as far as age range difference. And we're explaining, all facilities aren't the right fit. Just because it's a facility doesn't mean it's the right fit for your loved one. Oftentimes, families will end up in assisted living. And then within a couple of weeks, the assisted living's telling the family, you need to hire in-home care to come in and take care of your, the resident, their family member. So I say, make sure you're asking the right questions, because assisted living really is a very misleading name, right? And you know what I'm talking about. There's not a lot of assistance. They will come by, put you on a schedule. Here's your 8-minute shower. One place says you get 8 minutes. They literally time it because they have a whole nother hallway to go down to give showers. Or they'll come by, here's your meds. Well, if the meds had to be taken with food and that person hasn't woken up and ate food yet, it throws everything kind of, out of sync. What's the recommendation when somebody's not fully independent, but the family's thinking we need to look at a facility?
That's an awesome question, because there are so many different options and there are so many different questions you need to ask. And if you're not aware or thinking about those things when you go look at a facility or even call, some people don't have the means to necessarily go and look at a whole bunch of different places, or the timing needs it needs to happen quickly, right? So assisted living is, unfortunately, that's one of the big misnomers. You obviously know that, but there are usually a list of menu items that you can add on with assisted living, but they don't just come with the room. They don't just come with the apartment. So a lot of senior care is about asking a lot of questions, and that's why we need to build up our advocacy skills, because sometimes not everyone will respond, kindly or generously with their time. And we've got to be able to be that strong and steady presence and keep asking for our loved ones. But another thing that a lot of people don't know is that most of this care is private pay.
Right.
That's tough. We do not have a big safety net system in our country, or hardly any safety net system. And if you search around online, you'll see, we'll call this place for services or look at this type of a program. But if you really dig into those, most of those programs have 6 to 12 month plus waits.
Right.
It's really hard. That's why preparing in advance is really key.
Well, and two, just to piggyback on that for a moment, even if the waiting list wasn't very long, let's say it was a few weeks or a few days, a lot of them are also financially qualifying too. So I'm thinking of like the aid and attendance through the VA. We have people say, well, my dad, he was a veteran, he was in the Army in the 80s. Well, aid and attendance is designed for wartime veterans and their spouses. So if the spouse was married to a wartime veteran, the wartime veteran has either deceased or is no longer or doesn't need care, the spouse can still qualify for a reduced amount, but they still look at your financials. And it's not as high of a burden as, say, Medicaid is, but it's still pretty significantly high. And so that wartime veteran oftentimes, gets disqualified by the financial requirements. With us, we always tell families, and they always think, well, Medicare pays for this. No, Medicare pays for the home health care side. And even their, whoever their Medicare policies are through, we have called just to, kind of reassure the person that's insisting. And we've even had them at the customer support level say, well, yeah, we'll pay for this. And then we're educating the customer service people, and they're like, oh, you're right. That's a big deal because, like you said, assisted living, memory care, independent living, home care, none of these types of services will accept Medicare. And it's not for lack of wanting to, it's just not covered under Medicare.
Right.
And I think at some point that's going to have to change in the future, because I know you talk about the gray tsunami. I mean, it's significant. It's very significant. And I like to harken back to the early days of COVID when, we're building makeshift hospitals and parking lots and taking over warehouses in preparation for all these COVID patients. Well, that's just not a reality for all the baby boomers and the care they're going to require.
Yeah. Yeah. Key point as far as taking the best care of yourself you can, encouraging your loved ones to take the best care of themselves that they can. And that's something that, generations differ a lot on.
Right.
A lot of people have this perception like, well, I'm going to work so hard until I get older and then I'll kind of rest. But resting our body, as far as not really doing anything physically or mentally, is not working out for people very well.
Right. Well, and I would say even generations, but even cultures. A lot of cultures, we see this with our business. Certain cultures have different ideas of how they take care of their seniors and their elderly, and it's a stark difference. Let's talk about if a person had a stroke or, let's say, a significant fall, and the facility's saying, well, we think they're as good as they can get. They're not going to get any better. But the family's like, no, I'm convinced that my mom, my dad, or whoever the loved one may be, that we can improve, that there's still hope, there's still a possibility. How do they reconcile that with a facility who's basically saying, well, we're going to discontinue this, we're going to discontinue that because we've reached the peak, improvement that we're seeing we can provide?
Yeah, and facilities do have certain requirements as far as what they can offer, and, progress needs to be shown up to a certain point. You can appeal decisions. You can ask for the facility to review that and ask for Medicare or insurance to review that decision and see if they could possibly keep improving with more therapy or care. You can ask for a second opinion, or you can, and this is something that's, we have to be careful. I want to be really cognizant of recommending things, because much of this, if you go anywhere outside of the guidance, is going to be private pay.
Right.
But you can ask for a second opinion, ask someone to come in and evaluate that person again. The risk is, and the facilities don't want to say, your person's not going to get any better. Like, this is it. They don't want that for you. They're not trying to, impact your family negatively. They're really trying to present the case that they see in the current situation. Yes, there's a chance that people could continue to get better, but the reality most of the time now is that aging is a long, slow decline. So once someone has experienced an illness or injury that's very severe and they're an older body, they don't just pop back to how they were before. And that's something that families have a really difficult time dealing with, because you can have a really severe problem and actually, have a significantly decreased function just from that episode. So trust your facility recommendations, trust the professionals as much as you can. Being an advocate is not about being aggressive or thinking you know the right thing. Being an advocate is about finding out what everyone's opinions and recommendations are and trying to make the best decision in the present.
Mm-hmm. Do you, now this will go right into home health care. When families get home health care, oftentimes, again, they have this perception that, oh, we're going to have a nurse at dad's house. We're going to have the therapist there. We're getting it all. But that's not really the reality of it. Why don't you explain the guidelines and what having home health care really means? Because I think that's also something that is so misunderstood. And sometimes it's even coming from the professionals themselves, right? Where they're saying it and just kind of taking for granted that that person knows what that means. And then they're leaving there thinking, oh, we're going to have this nurse with us and, everything's wonderful.
Yeah. And even the verbiage, home health and home care, are completely different things. And, even professionals say in the hospital, if they've never been on that side in the more of the outpatient setting, they don't necessarily say the right thing. And so you want to, make sure you talk with somebody who has experience in those industries and or the insurance company. But home health, skilled home health care, is something that is covered by Medicare and a lot of insurance companies, but it's a limited benefit. So you have to have certain criteria met to get qualified for that. Like, it has to be really hard for the person to get out of the house to go to, say, an outpatient physical therapy clinic, because then they can have those services at home. And yes, there will be a registered nurse, there will be a physical therapist but they only come for about an hour or so at a time. They come, they take care of the immediate need, whatever that might be. If it's running an IV medication, or taking care of a surgical wound, or checking with the new diabetic to make sure that they're monitoring their blood sugars correctly. They come and then they go. And there's a perception that, well, we're getting 24-hour care and it's going to be covered and it's going to be so great. And our system just doesn't have that. Right. Home care, which obviously you're very familiar with, is an awesome service, but it's not a Medicare covered service. It's a different thing.
And they can work in conjunction with each other. They do not
Absolutely.
conflict or overlap. Medicare will not cancel you because you have home care, and that's one of the things, families think, well, we have the nurse coming, so we need to wait till that's done. 9 weeks at a time you're certified for. And something we tell families too, it can get recertified. You can get another 9 weeks if the need still exists. But again, when these home health nurses are going in to do the intake, the evaluation, they're targeting what we can get this person to, what the goal is.
Yes.
If that goal is met after 3 weeks or 4 weeks, it stops after 3 or 4 weeks. And then the other part too is compliancy. If the patient's not being compliant, the nurse will stop the services immediately because they have to answer to Medicare also. Yeah. I always encourage people really understand whether it's home care, home health care, a visiting physician, understand what services they provide and what services they don't provide. Because again, we had a family recently, Catie, where they we were helping the family just 3 or 4 days a week for 4 or 5 hours, and we kept encouraging the family to add more time because this woman lived alone. Her dementia had really progressed, and our staff would show up and she would be literally almost hanging off her front porch, sitting on a rail. I mean, one sit back, she's going to be severely hurt. The family lived hours and hours away, so they finally came down, and while they were down, they admitted her into hospice. So the family called and said, after next week, we're not going to need your services anymore. We were shocked. Why is that? Because we have hospice. Hospice is going to be with her 24/7. And so, we just tried, to educate her so she understood, and she was insistent. She knew, she talked to them. Well, the next day when they came to do the admission for hospice, then she came to our offices and explained, no, I made a mistake. She's under their care 24/7, but they're not going to be with her 24/7. But those small details really get lost in translation so often. And, it'd just be nice if people had your experience or our experience, and when they're meeting with these families, do a better job of really explaining it, because for a lot of these families, they have no, pre-existing healthcare education at all whatsoever on how the system works and how it doesn't work. And sometimes it's to their, detriment.
Yeah.
You know?
Yeah, and home care is an exceptional service, and I definitely would recommend it for people who need help with the 24/7 care or at a distance. And it works in conjunction with everything else.
Right.
But yeah, people don't understand the broad continuum of all of the services and all of the issues that are, and why would they? I wouldn't expect people to understand that. But that's why we're out here. That's why we're trying to educate.
And they don't know what they don't know, right?
That's right.
So let's say another issue that comes up quite frequently is when a patient, they're more elderly, so they might have several different doctors and specialists that they work with, and they're getting all these different prescriptions from all these different services. That can first and foremost be overwhelming, right? Trying to keep it organized and keeping things straight. But is that okay? What do you recommend families do to make sure, their loved one isn't getting, a contraindicated medication, or maybe the parent or whoever the loved one is doesn't think to let the specialist know, well, I'm also seeing this, cardiologist for this issue, and they're seeing a neurologist for a different issue, and they're getting different scripts, and it can get very confusing, overwhelming, and it can at times be dangerous. How do you recommend families handle that?
So the first thing is, we have to realize that even though everybody, when we go to a specialist or to the hospital, everybody has a computer sitting in front of them, their computers do not talk to each other, which I understand is crazy. That's beyond, that's a whole different issue, really. But yes, there are electronic health records for that specific physician or for that specific unit of the hospital, but they do not all talk to each other. So that's a big problem. The specialist probably doesn't even know all the medications that your person is on, which is pretty frightening. Your pharmacist or the person's pharmacist can be really your good friend, because they can identify medication potential medication errors and conflicts, and that's one place to talk to. But another thing is, and people probably think this sounds like overkill, but it's really helpful, is to track the person's medications yourself. Have an ongoing list. Keep it up to date, review it every once in a while, look through the house and try to find all the different medication bottles and see if the pills inside the bottle look the same, because people tend to just kind of get their own system, and it's really scary. It's very scary because we treat medication as if it's, a candy, and it's not. All these pills have side effects and have potential to do damage if not used correctly.
Now let's say a loved one is not taking their pills correctly and they won't allow you to help them sort their pills. How do you suggest a family member watching this addresses that issue to avoid
That's
as
one of
much
those.
conflict as possible?
Yeah, that's one of the toughest things, truly, because so many ER visits result from people taking their pills incorrectly, either too much or not enough. And what my recommendation is if you can get with your person into the primary and you have the list of all the things that you think that you have found in the house, all the medications, and try to get those cut down. Try to minimize the number of medications because a lot of times people when they have an issue for a long time, say high blood pressure, they've had it for years and years, they'll end up on multiple medications for the same thing. So if you can get those medications minimized, especially if there are any memory issues, that's really helpful.
Yeah, and I like that you touched on the pharmacy. They're the ones seeing all the pills and the scripts come through. Especially if you're the POA, they can share that information with you and they can kind of keep a watch on things. And another thing, and I don't know if you have an opinion on this, we recommend to families quite often, especially if it's an elderly person dealing with any sort of memory issues and even, rheumatoid arthritis, because, the pill bottles and the small pills and your fine motor skills. But a lot of your pharmacies now, they will pre-package all of your medications into a nice little baggie and you just roll it off the dispenser. So it's already sorted for you by, day and time that you're supposed to take it. And it eliminates all the bottles and bottles of pills. What's your opinion on those?
I love those. Yeah, they're great. If you have a loved one who's really wants to do things for themselves, even with memory issues or whatnot, if you can, express to them, hey, this little pack has everything. This is all that you need. That helps them feel a little bit better about it too, because they think they're doing a great thing with, when they have all the bottles of pills and they're trying to work out their own system. They think they're taking care of themselves, and we don't want to take that away. We just want to make it safer.
Absolutely. So, Catie, what would be your number one message you'd like to leave our viewers and listeners with when it comes to pre-planning or the importance of planning for their elderly loved ones?
So, Lance, I love that question, and I could talk all day about it, honestly, because I'm so
Take as much
passionate
time as you need.
about it. But we prepare for so many things in life, right? We prepare for getting married, for sending kids to college, retirement, and then we don't prepare really at all for watching our loved ones get older. And what a blessing it is that they get older because, the alternative's not very fun.
Right.
So let's talk about it. Let's open up the conversation. Let's normalize aging. It is normal to get older. It is normal to have health issues, but also let's look at wellness in a really practical sense. Wellness is not about how we look. It's not about, staying young per se. For all of us, let's figure out what feels good to us, what feels good to our aging parents and any loved ones, and let's help them do that.
Absolutely.
So it's really the quality of life that I'm after, being around healthcare so much. So many people spend a significant amount of their time at medical appointments and dealing with medical issues toward the end of their life. Actually, the most money spent in healthcare is the last year of life, which is think about that. Is that what we all want to be doing? So talk about it. I have people in my family who don't want to talk about being old or dying. That's they just don't want to talk about it. But what they will talk about is, hey, would you like to go with the grandkids and take a walk around the block? Something that really feels good. And I think that's part of the missing puzzle pieces is that quality of life.
Right, right. And I think erasing the stigma and the fear, making it more, common or acceptable to talk about those types of issues too without feeling afraid of them. We do support groups for families and different seminars here locally, and we tell people, talk to your loved ones while it's still during good times, not at a crisis time, where you can say, what are your thoughts on this? What would you want to have happen? One of my most favorite resources for, planning is 5 Wishes. It's very straightforward. It's not doom and gloom, but it also makes sure that your loved one is getting the treatment and, the care that they want to have in the event that they can't advocate for themselves, because none of us know when that time may come or when it may happen. I first learned of 5 Wishes taking my hospice and palliative course in college, and we had to all fill it out as part of an assignment. And at the time, a lot younger, a little more naive, and it was like, well, why do I need this right now? And it's only now later in life, you're like, because it can happen at any time, and you just don't know. We don't have control over that necessarily. So I just encourage families to have a conversation, learn about the resources. Maybe it's not the funnest thing to do or how you want to spend your time, but it's better to do it during calm time than in a crisis time,
Absolutely.
So nursecatie.com is your website, and
yes,
we'll have the links up in the show notes and up on the screen as well. And we just we love all the stuff you're doing for Generation X, and hopefully we'll have you again on the show. And my last question for you today, Catie, is where is Dr. Catie in the next 5 years?
Ooh. Wow, 5 years seems like a long time.
All right, let's do a year. Let's do a year.
Okay, a year. I want to keep doing what I'm doing. I really love serving people. I love being a nurse. I love informing people and educating, and I just want to keep doing it.
Any exciting projects you're working on behind the scenes?
So we are in this fun phase at our house of launching kids into adulthood. So we're doing that at home. And while we do that, it just reminds me so much of how quickly life goes and how much we want to be present each day. And that has really deepened my relationship with other older family members that I've appreciated so much. And I just want to bring that into the interwebs, and hopefully everybody can get a taste of that, because it's a good place to be.
I just saw something the other day. It said, what is the best part of raising kids? The answer was watching them grow. Then the follow-up question, what's the hardest part about raising kids? Watching them grow. Yeah,
absolutely.
It's so true. It goes very fast and very quick, but we do appreciate you and all the great work you're doing. Love the content. We encourage everybody to go check it out, and hopefully we'll talk again in the future.
Sounds great. Thanks so much, Lance.
You're welcome. Thank you. Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Dr. Catie Chung, and we look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.